This is Mon Health Live, your source for the latest news, numbers, and vaccine information related to COVID-19. It's what you need to know now to make informed decisions for you and your family. Here are your hosts, Mon Health System CEO David Goldberg, Mon Health Chief Nurse Executive Dr. Crystal Atkinson, and WAJR's Kyle Wiggs.
And good Saturday morning. Welcome to another edition of Mon Health Live as we track COVID-19 and get you the information you need to know. Dr. Crystal Atkinson is with us. And Dr. Atkinson, good morning. Thanks for coming on.
Good morning, Kyle.
Also, we've got a special guest, Dr. Andrew Heiskell, who's been a surgeon in this community for many, many years, many decades. And Dr. Heiskell, thanks for joining us on this Saturday.
My pleasure, Kyle. Thank you.
Dr. Atkinson, let's start with you. The latest COVID numbers, I guess we've been up and down a little bit in this community. The vaccines are going very, very well. A lot of the protocols are still in place in terms of public health. Mask wearing is still very prevalent in public buildings and in restaurants and grocery stores, etc. What about the numbers? We saw a little bit of an uptick. Have we leveled off a little bit?
No, just, from last week, we are up about a percentage more from a positivity rate. So that does draw a little bit of concern. But, Kyle, just as you just laid it all out, we want to make sure that we're continuing, regardless of where we're going, grocery stores, within clinics, hospitals, etc. We want to continue to make sure that we're maintaining our social distance, wearing our mask, etc. Now, on the flip side, extremely excited about the continued flow of people coming to our community events to be able to get vaccines. As of, a couple of weeks ago, we don't have the final numbers for March yet, but we vaccinated over 35,000 people. So just really excited about that and continued enthusiasm for getting our community vaccinated.
Okay, so that's 35,000 vaccinated in this community. Is that one shot or two or a combination?
Yes, a combination of both. So a little over 21,000 for the first dose, and then for the boosters, just around 13,000.
And Dr. Atkinson, healthcare workers were among the first to get vaccinated, and I would imagine all of those who have wanted the vaccine have had at least one dose, if not both doses already, correct?
That's correct.
Okay,
yes.
Very good. Dr. Heiskell, what would you say to an individual, to a resident of Monongalia County or Morgantown that may be on the fence? They may need a little encouragement to take that step and get the vaccine.
Well, and believe me, I have been questioned by many patients, many friends about what I thought they should do. And I told them to do exactly what I did, which is stick my arm out there and get this shot. There's no question about it. I thought that, it was really nice that they were doing the healthcare workers first, because I was one of the first ones called, and I gladly took my shot. And I thanked the guy. I said, "I'm glad you're doing the healthcare workers first. I'm glad I got mine in." And he said, "Doc, we didn't do it because you're a healthcare worker. We did it because you're old." Okay? So I think, I've had many people ask me, and there's no question, the side that I see that other people don't is what COVID's really like if it affects you. And it's not just a bad flu. It can have long-lasting effects. And I've seen people who have bed sores on their cheeks because they were on the ventilator in a prone position. So COVID is nothing to mess around with. So get your shot and get it soon.
Mm-hmm. And the opportunity is there, Dr. Atkinson. In this community, it's opened up pretty much to where if you're 16 or older, you can get that vaccine. You get your appointment and get your vaccine.
That's absolutely correct. And what we're really excited about, opportunity that we have within our system, that we're extending that to our employees' family members, just to make it even more easy for people to be able to get vaccinated.
And that's at the center, at the old Sears location at the mall. And everyone knows where that is. It's right off the interstate. And it seems like, Dr. Atkinson, that by all accounts, that place runs like clockwork.
They do a fantastic job. I mean, just as you were sharing last week, I mean, a round trip just in and out can be as little as 10 minutes. So that is certainly time that can be very well spent to be able to keep people safe.
Okay. All right. It's been a year. It's hard to believe, but it's been over a year now, right at a year. The first COVID patient being seen at Mont Health. Again, that's incredible. And Dr. Heiskell, you say you've had personal interaction with people who have had pretty significant bouts with this COVID-19 virus. Can you take a moment there and just explain what you've seen and how people have, every story is different, but there has been a lot of people that have battled this.
Yeah, it's, you sort of get used to being around sick people, but when you see your friends getting sick and when you see hospital employees getting sick, it really drives it home. And fortunately, we're doing very well now. Everything is good, but I've seen the worst. I've seen people die from COVID. I've seen people be on long-term ventilators with COVID, and I've seen people real slow to get better. So while that's not the usual course, usually the average course is people, it's not that bad, but it can be very bad.
And go ahead.
That leaves an impression.
Yeah, absolutely. A question for both of you. Obviously, we see the light at the end of the tunnel. People are vaccinated. It's spring. People are getting outside more. There's fewer and fewer large gatherings indoors. Again, people are outside. But Dr. Atkinson, it's not time quite yet to relax. You still need to be vigilant with all the protocols.
You're absolutely right. As we've even seen urging from our CDC director, we just have to be continue to be vigilant. I know that it's been a long road, but this is the only thing that we can continue to do in addition to, of course, getting vaccinated, just to make sure that we're taking those protocols and being safe. Dr.
Heiskell, anything to add to that?
Only that even though you've been vaccinated, that protects you. You can still carry the virus and spread it. So you need to wear your mask and take all the appropriate precautions. At some point, we'll be able to drop the mask and the social distancing, but not yet.
All right, sometime soon, hopefully. Dr. Yes. Heiskell, my notes say that you've been a surgeon in this community since 1975. How is that possible?
Don't bring that up. No, it's. I've been very blessed, very fortunate. My dad and my granddad were both surgeons here. I trained in Northwestern, came back, and my dad died at age 54. So I've been very blessed to go beyond that, and I just love what I do. I wake up every morning waiting to go to the hospital. And I've been very fortunate. That's basically all I can say.
Okay. Where is your office located, and what are some of the procedures that you specialize in?
We're at the Suncrest Town Center building that sits right above Kroger's and 600 Town Center Drive. And, I see all kinds of general surgery patients, including people with thyroid disease, parathyroid disease, breast lumps, breast cancer, colon cancer, gallbladder disease, hernias, hemorrhoids. I see a wide spectrum of people, and we just try to do the best we can for them, and often it's quite rewarding.
Mm-hmm. Before we take our first break here, I know we've talked with Dr. Atkinson and with David each and every week talking about the protocols in place at the hospital and how clean it is. I know David said many, many times it's the cleanest hospital he's ever seen. Dr. Heiskell, what about your building there? You mentioned 600 Town Center Drive, the Mont Health Surgical Care at Suncrest Town Center. How confident can people be when they enter your facility that everything's clean and all the protocols are in place?
Oh, we do an extensive cleaning of each room after each patient. We screen every person that comes in, not just the patient. We ask every person if they have any symptoms. We check their temperature. This is not being done throughout the county, but in the Mon Health buildings, it is being done. And you can trust that you will get the maximum cleanliness and the least risk of getting COVID by using our facilities. Mm-hmm. It's hard, and everybody's working hard, but we do our best to make sure everything gets done.
Yeah, it's an extra step, but it's necessary, and it's something that I know Dr. Atkinson, the entire Mon Health system has made a commitment to.
Absolutely. There's nothing that we want to we will not do to be able to keep our patients and visitors safe.
All right, very good. This is Mon Health Live for this Saturday morning. Thanks for joining us on 104.5 FM, 1440 AM, WAJR. We've got a break coming up. We'll return Dr. Andrew Heiskell, our guest, Dr. Crystal Atkinson, as well. Stay with us as Mon Health Live continues on WAJR after this.
Tracking COVID-19 with the Mon Health experts. This is Mon Health Live. Here's Mon Health CEO David Goldberg and Chief Nurse Executive Dr. Crystal Atkinson.
Dr. Atkinson with us on this Saturday morning edition of Mon Health Live. We appreciate you joining us as well. Our special guest, Dr. Andrew Heiskell. He's been a surgeon in the community for many, many decades. Again, his office at Mon Health Surgical Care at Suncrest Town Center, 600 Town Center Drive. And Dr. Heiskell, as we jump back into the conversation here, is it safe for patients to come back to get elective surgeries? I'd imagine you've resumed many of these elective surgeries, and people are taking advantage of that again at this point, right?
Yes, we're basically doing everything at this point, and not only is it safe to do so, it may be unsafe to not do so, because a lot of people had scheduled screening colonoscopies and scheduled mammograms, and they were afraid to come to the hospital because of the COVID. That's how we pick up things early, so while they're still curable. If you wait too long, then the breast cancer, the colon cancer, they're not curable anymore. And then you're talking about chemotherapy and a long, bad course of treatment. So I would encourage everybody to catch up now. Anything you put off due to the COVID, now's the time to get caught up. And we're certainly we're a lot busier now with people who are due for their screening now, as well as those who were due in the past several months are now catching up. So that's a good thing.
All right. So all screenings and all surgical procedures available once again, including elective and minimally invasive surgeries, right?
Absolutely. Anything we could do before the COVID, we can do now.
All right. Very good. It was the month of March. Of course, we're in the first week of April, although it didn't seem like it. Thursday and Friday got a little chilly. But March, Dr. Heiskell, was Colon Cancer Awareness Month. So how important is that to people to put an emphasis on that, on the screening for colon cancer?
It's extremely important. Colon cancer is the second leading cause of death in West Virginia. And the thing that people forget about or don't realize is that colon cancer is one of the few cancers that's preventable. In other words, every colon cancer starts out as a little polyp, a little growth inside of the colon. And if we identify the colon polyp through colonoscopy and remove it, then we prevented that cancer. And that's the whole purpose of screening, is to find the polyps, get them out before they turn cancers. And in doing so, that has lowered the risk of colon cancer across the country if people get their surveillance, if they get their screening colonoscopies. So it's extremely important to have something you can do to prevent a cancer. Other cancers, you can't necessarily prevent them.
All right, so colon cancer, the screening is the colonoscopy. Not the most pleasant thing, but certainly something that that everybody can prep for and get through, and it's extremely important.
That's correct. Now, there are some other tests that can be done on stool samples that are a form of screening, but they're not nearly as sensitive as a colonoscopy.
Mm-hmm. All right, so colonoscopy is the thing. Now, what's the magic number? It used to be 50. Is it still 50, or is it a better idea to get screened perhaps maybe in your 40s?
That's a good point, because many of the institutions are recommending screening starting at age 45, because we're seeing colon cancer show up in younger people. So I recommend that they start their screening at age 45, especially if they've had any family history of colon cancer, any family history of colon polyps. Now, Medicare doesn't recognize 45. They still stick with 50. But I think 45 is the right answer. The difference between screening and diagnostic is important, though, because if you're having symptoms, then most insurance companies will pay for the colon screening at an earlier age, because it's diagnostic. If, say, you're having crampy abdominal pain or you're passing blood, then those can be signs of colon cancer, and the colonoscopy is a diagnostic colonoscopy, not a screening colonoscopy. So don't put off your colonoscopy until you're 50 if you're having symptoms especially.
Okay.
But we're seeing it in younger and younger people.
All right, so if you do get screened at 45, at 48, at 50, and it's clean, then that's a 10-year window, right? You're okay in terms of the next colonoscopy for about 10 years.
That is correct, unless you have a strong family history of colon cancer or a strong family history of colon polyps. Then you have to be a little more vigilant, and often we'll see people that are in the high-risk group, and we'll give them what we call stool cards to send in stool samples every year, just looking for blood. We don't need to do the colonoscopy every year, but a lot of people with strong family histories, we need to scope every 5 years. Mm-hmm. And then we can do these other tests in between.
All right. So, again, March was Colon Cancer Awareness Month. That month is past, but still, it doesn't mean that you need to pay less attention to it. Get screened, get the colonoscopy. And Doctor, I understand surgery has become refined a little bit, safer, if you will, because of enhanced recovery protocols. If someone needs surgery, it's not quite as big of an ordeal as it used to be.
That's correct. We started this at Mon about 6 years ago, and it makes a huge difference. Prior to using enhanced recovery techniques, the average hospitalization for resection of a colon cancer was 5 to 7 days. We brought it down considerably, and I personally have had several patients who only spent 2 nights in the hospital, even though they had a large segment of their intestine removed and went through major surgery. So it's made a huge difference. Basically, it's the recovery that's sped up. And one of the ways we do it is we create a pain-free environment without using narcotics, and that's been a tremendous help.
All right, you can reach Dr. Heiskell, by the way, 304-598-2200. That's the number for his office, Dr. Andrew Heiskell. Guys, we got about 2 minutes left. Dr. Atkinson is still with us. And, Doctor, again, the light's out there at the end of the tunnel. People are getting vaccinated. What do you want people to know here as we head into the month of April, deeper into the spring, about keeping COVID-19 at bay?
Yeah, I think that those of us that have been vaccinated, I think that one of the good things is to make sure that we're sharing our experiences. Just like you've talked with us in the past, we haven't had any bad side effects as far as the vaccines are concerned. And those that you care about, make sure that they know that these processes are in place to be able to keep us all safe.
Mm-hmm. And one thing Dr. Heiskell said, I'm not sure many people understand. Okay, you've been vaccinated from it. You may not get ill from it, but you can still pass the virus, correct?
Absolutely. We still can be asymptomatic carriers, so we want to make sure that's why we still continue to wear the mask. That's why we continue to focus on social distancing and good hand hygiene.
Mm-hmm. Dr. Heiskell, anything to add to that?
Just 3 words. Get the shot.
It's West Virginia's best shot, right? Get the shot.
That's right.
All right, very good. We got about a minute left in the program, and, there are some big things coming up this spring in terms of the high schools are back in. They're going to have graduation ceremonies. We've got state basketball tournaments coming up, and the local teams have great prospects of getting to the state tournament. So there are events coming up, but people need to be careful. I mean, we can't emphasize that enough, Dr. Atkinson. Just keep the protocols in place and keep watching out for each other.
Absolutely. Whatever is posted in those arenas, let's make sure that we're being vigilant. And then that's just really being respectful of ourselves and each other. We can all get through this if we do it together.
All right, so 35,000 of us residents here in this community have been vaccinated, and that number needs to go up. And it's an easy process. I think we all three, talking to the community out there, I've had one of my shots. I'm going to get my second one here in the next 10 days or so. But you two have both been fully vaccinated, and it's not a big deal. Just go out and do it.
Absolutely, not a big deal at all.
All right,
that's correct.
Very good. Dr. Andrew Heiskell, he's been our special guest. Doctor, thanks for your input this morning. Great information. We appreciate your time.
My pleasure, Kyle.
And Dr. Atkinson as well. We'll talk to you again next week.
Sounds great. Enjoy the rest of your weekend. Happy Easter.
Happy Easter to everybody. That is Mon Health Live on WAJR for this Saturday. Thanks for listening. Saturday.